Welcome back to Wave Listens Live. I'm Sean Bowdy. Joining me now is Freedom Mini Dental Implants to talk about their small diameter, one-piece dental implants that are lower cost and less invasive than traditional surgical implants. Welcome, Dr. Regan Ackerman. It's always a pleasure to have you here.
Thanks for having me today.
And as always, you came with show and tell, and I always appreciate that because I am a visual learner. I've told you that plenty of times. But for those watching who are maybe unfamiliar with Freedom Mini Dental Implants, why don't you tell them a little bit about what they are?
Yeah, so essentially the mini part just means it's a smaller diameter implant, which, as he mentions, makes it less invasive, less healing time, and usually a lot less costly than the surgical implants. And the other biggest thing it does is make people a candidate for implants that may not have been a candidate for the bigger surgical implants, because I don't have to have as much bone to place an implant because it is a smaller diameter. So people that were told they had to have major bone grafting or sinus lifts or didn't have enough bone could be a candidate for the mini dental implant. And we're going to show all the ways I use them for, dentures, get rid of dentures, single teeth. We do free consultations. So just call, make the appointment. There's no charge. It includes the 3D x-ray because I do have to confirm you do have enough bone for a mini dental implant, but you don't have to have as much as for a surgical big
And I think this that you brought here really does showcase that well, the difference of the size of what you actually need and how much bone you actually need.
Definitely. When I show this to people, they're like, oh, that makes so much more sense. When I place an implant, so I do not make this big hole. That's the surgical traditional implant way, and that kind of shows how much bone they have to have. So I'm going to cover that up because that is not the hole I make. I make this tiny little hole right here, and I don't have to make any incisions or stitches. I essentially just local anesthetic. I don't do sedation. I do not have to put you to sleep. I'm essentially making a little pilot hole through the gum into the bone, and then my implant, it's a one-piece titanium implant. It screws and torques into the bone, and a lot of times the day I put the implant in, you're leaving with either a tooth there or your denture snapped in, whatever the procedure is you're having. But I think it just shows volumes as I don't have to have as much bone. I just have to have some bone to work with.
And you've got the ones that in front of us here that they're the single piece that go around. You can get it to where they don't have any part of the roof of their mouth as well. But for someone who is maybe annoyed with their dentures because they're one piece, because it is just literally a mouthful when it comes to trying to do things with it, you also have these single tooth implants that I feel like people can really benefit from if it's just maybe parts of their mouth that need it. You don't have to go through the whole process of doing that.
I'll kind of show that because I know we talk about dentures a lot and getting rid of denture glue, but a lot of people are struggling. Maybe they have a partial or what we call a flipper. If you have it, you know what it is because you hate it. So say you're just missing one tooth or 2 or 3 teeth, I'm able to place the implant same way, no incisions or stitches. The day I put the implant in, you'll leave with a temporary tooth there, so you get rid of that flipper or that partial that day, and then normally you come back maybe a month later. You don't have to wait 3 to 6 months like you do with the big surgical ones. And then we have your nice, pretty permanent crown, and it gets cemented on permanently onto that implant. And same thing, a lot of people are missing their molars in the back or multiple teeth next to each other, and they want more to chew with or more to fill out their smile. So I'm able to place the mini dental implants, make a bridge of teeth, get cemented permanently onto those implants. I had a patient say it great. She's like, I feel like I grew my tooth back. So
that's good too for like if you have damage in your mouth or if there's some kind of like trauma that happened somewhere in the mouth, you can replace just the area that's infected or teeth.
Yeah, it doesn't have to be a whole mouth.
And that's good too because you mentioned sometimes children have the instances where like they have trauma in their mouth and they don't want to do
all the ones.
And their bones are smaller, so you can use this to help them.
Yeah, I had a patient the other day. I think I was telling you about. A lot of people are born without certain permanent teeth. This patient, she was 18. She had gone through braces, gone through it all, and then was told she still didn't have enough room to replace 2 bottom teeth here in the front because there wasn't enough room to put the surgical big implants in. So she came to me wearing this retainer, trying to go to prom with it, and I was able to do the mini dental implants for her and give her an option so that she doesn't have to have a retainer with 2 fake teeth on it for the rest of her life.
And I want to get into some of the before and after pictures that you brought us, because I think they really do show you just the difference that it can make, not only in someone's smile, but I think it is a good visual component to changing someone's life as well as their smile.
Yeah, so this is Tony. He had struggled with periodontal disease and bone loss, kind of just knew his teeth were failing and he needed, to have all his teeth removed, knew he did not want dentures long term. So we were able to do the permanent teeth for him. I'm sure we'll show that later, but he has nothing on the roof of his mouth. He does not have to take those teeth in and out every day. They are cemented permanently in, and he brushes them every day just like regular teeth, toothbrush, toothpaste. We gave him a water pick to keep it clean. He gets his teeth cleaned every 6 months just like regular teeth, but he doesn't have a denture. He doesn't have to use glue or anything like that, and I think just definitely life-changing as far as the confidence in his smile, and he's not embarrassed about his teeth anymore.
I know we've got one more too I want to get to.
Yeah, so she came to me with a lot of broken teeth, decayed, fracture, didn't want dentures long term, so we did the permanent teeth on her as well. So she has nothing on the roof of her mouth. She can taste all of her food and brushes them every day and can eat steak and salad and all those good things. When she goes to a restaurant, she doesn't have to worry about what she can and cannot order off the menu, because she can order whatever she wants.
Yes, and exactly. So whether it's the single tooth ones that interest you, or whether it's the full mouth permanent teeth that really can change your life for that, you can visit freedomimplants.com or call that number on your screen, 502-937-4930, to learn all about those procedures. Dr. Ackerman, thanks so much.
Thanks for having me.
Yep.